day, ma'am. I am Shikaya here, Ikira. Here is student first. May I know your name, age, and date of birth? I'm 20 years old, April 5, 2008. So, for today, ma'am, we'll be assessing your cranial nerve. So, the purpose of this assessment is to identify problems and assess your vital information. So, before we start, ma'am, allow me to perform hand hygiene and put on gloves for safety purposes, and then close the door to the greetings for your I'll be assessing first the olfactory nerve, which is responsible for the sense of smell. Before we start, I'll be checking first the nasal passage. Okay, all clear. So, I have here 2 items, ma'am, that I need you to identify. Would that be okay? Okay, can you close your eyes and block your other nostril? Can you identify the smell, ma'am? Okay, coffee, the other one. Can you identify, ma'am? Okay. Okay, so the patient were able to identify the odor, which is good and normal. An abnormal finding could be anosmia or loss of smell, hyposmia or diminished smell associated with optic nerve lesion. Next to assess is the optic nerve, including the visual acuity, the confrontation test, and the light reflex. So we'll assess first the visual acuity. We have here the Snellen chart, ma'am. So I need you to read it from the biggest letter to the smallest letter. So can you stand up po? Okay. E, F, B, P, O, C, L, P, E, D, B, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, C, D, D, E, F, P, O, P, E, C. Okay. Next is the confrontation test. Pwede po ba kayong tumarap sa akin? Okay, so, I need you to cover your other eye. And then, I need you to tell me where my hands are wiggling. We have the up, down, left, and right. Okay? Look directly into my eye, ma'am. Right. Up. Right. Down. Okay, to the other eye. Left. Up. Down. Left. Okay. So, next to assess is the light reflex. So, we have here the pen light. Reading, I can see that the patient has 20/20 vision and it is normal. An abnormal finding could be reduced visual acuity or 20/30 to 20/60 mild vision loss, or pag napabayaan can lead to severe visual impairment. For the next assessment, we'll be examining for the oculomotor nerve or the examination of the cranial 3, 4, and 6. So we'll be looking for the ptosis, squint eye, light reflex, accommodation, and extraocular movement. So let's start. So, ma'am, I need you to look up with your eyes only, and then down, left and right. Okay. Okay. Can you look up? Right, left, down, right, left. So for the light reflex, I have here my pen again. So for next month, I need you to follow what will I'm going to say. So I have here the pen light and me. When I say pen light, you focus your eye on the pen light, and when I say me, you focus your eyes on me. Okay? Pen light, pen light, me, pen light, me, pen light, me. So a normal finding on ptosis is upper eyelids cover the 1/6 of the cornea, small part of the sclera and iris, and an abnormal finding is the presence of ptosis or eyelid drooping. So on squint eye, the eye were aligned perfectly, which is good, and an abnormal finding is one of both of the eye is directed in different directions or focusing on one. For the right reflex pupil constrict directly in both eyes, which is normal. So if one eye did not constrict or react, it means that the patient has problem on the eye. For the accommodation, the pupil constrict upon focusing at near object and pupil dilate upon focusing at a far object. On the other hand, an abnormal finding is pupil do not dilate or constrict, blurred vision, up close and far away. For the extraocular, there is a smooth motion of the eye and there were no signs of nystagmus or shaking of the eye. Next to assess is the trigeminal nerves. This concerns our sensory function, including our sense of touch, pressure, temperature, pain, and vibration. So, I have here a cotton wrist, ma'am. I need you to identify where would I did it as you close your eyes. Okay. Can I open your eyes, ma'am? Ngayon naman po, can you clench your teeth? Harder, ma'am. Okay. So, for your reflexes, ma'am, we'll assessing first your corneal reflex. So, we have here another cotton mist. Can you look upward as I dip the cotton mist on your cornea? Okay. So, for the jaw jerk, ma'am, can you let your mouth lightly loose as I percuss? Okay, so the patient were able to feel the cotton mist and able to clench the teeth. The blinking and the eyelids are responsive and the jaw can open against resistance, and we don't elicit any abnormal response on the eye. Next to assess is the facial nerve. So for the sensory function, we have here different items to taste, ma'am, and I need you to identify each of them. Okay, so let's start. Next naman po na i-assess natin is your motor function. So, I need you to do as kung ano yung Okay? Okay, can you smile, ma'am? Raise your brows. Puff your cheeks. Can you close your eyes without any difficulties? Okay, open. So the patient were able to identify the taste, and there's no signs of hypoglosia or reduced ability to taste, or ageusia or loss of taste. The patient can respond and perform all the expressions I tell her to do without difficulty, and bilateral blink is responsive. So we will now move on the next step, which is the vestibulocochlear nerve, including the whispered voice test and Weber's and Rhine's test. So we'll be assessing first, ma'am, the whispered voice test. So I need you to repeat the numbers and letters that I'll be whispering. So I'll be positioning behind your back and uphold your under ear. Okay, so let's start, ma'am. Okay. The patient were able to repeat combinations of words and letters that were being whispered. And next is the Weber's and Rhine's test. So we'll be assessing first for the Weber's. We have here the tuning fork. Here the rotation mark. And then the Rhine's test. For the Weber's and Rhine's test, positive Weber's response is or can indicate sensory neural disturbance, and negative Rhine's indicate a conductive loss. Next step is to assess the glossopharyngeal nerve and ex valgus nerve. So we are doing first the gag reflex, or more reliable, the water swallow test. So we have your water. I need you to drink it, ma'am, as I observe the movement of your. And then next is for you, we'll be checking your uvula. So we have your hand reflexor. Say ma'am. And then can you puff your cheeks, no? The water easily passes from the mouth into the throat, which is good. That means too that there were no signs of dysphagia or difficulty swallowing. There's the presence of gagging, and uvula is in the midline. Next to assess is the accessory nerve. So can you shrug your shoulder, ma'am? Can you turn your head side to side? So the patient were able to do those. So we're now moving on the last assessment. So for the last assessment, we'll be assessing the hypoglossal nerve. So I need you to do some things, ma'am, very quickly. Okay, can you put your tongue from side to side? And do it again, ma'am, but with the pressure of my hand from the outside. Next, ma'am, is to assess your speech. Can you read the names on the wall?
Princess Julia and Prince Plastic.
Can you swallow, ma'am? Again. Okay. Your tongue with the difficulty, tongue resists pressure against the external cheek, and clear speech, and can swallow. Okay, so we are now done. Before leaving the patient, make sure to remove the gloves and put it in a proper trash bin, as well as the tongue depressor. Perform hand hygiene. And we are now ready to document the findings.